What are my most common cases? I would say my top 5 cases that I do mostly involve doing a central line or a complex central line, call it either a tunnel central venous catheter or a port. So we place ports in patients that have chemotherapy or that have something called sickle cell disease. Another very common procedures that I do is to treat peripheral artery disease through something called an angiogram, where I take images of the leg and the arteries, and then I use special techniques to open the blood flow in those blood vessels. Another thing I do is I treat blood clots in the leg. So I do thrombectomies and taking the blood clot out of the leg through a very small hole in the vein. And in that same vein or that same line of work is pulmonary embolectomies. So taking blood clots out of the lungs for somebody that might have had a blood clot go to the wrong place. I also do hepatobiliary work, which is in TIPS, and in that procedure, I make a shunt between 2 different systems in the body to help redirect blood flow around a sick liver. That usually happens when patients have something called cirrhosis, which is an injured liver. Another very common procedure that I do is called uterine fibroid embolization, or UAE. And in that procedure, when somebody has uterine fibroids that are either really big or bleeding, I can slow the blood flow to the uterus by using small beads to slow the flow and treat the fibroids. Patients love having this procedure because within 24 hours, they're usually back to their normal activity. And again, for all these procedures, we use a very, very tiny incision, usually no bigger than the size of an eraser, and we're able to do all this work.